As a woman, producing a whitish discharge is often a normal part of your body's physiology. But what happens when it becomes frequent, develops an unpleasant odor, or just feels unusual? These changes could indicate various types of infections. So in this video, we're going to talk about the different kinds of vaginal discharge, what they mean, and the possible infections they could be associated with. Hi guys, welcome back to my channel. My name is Medium Francis. Here we talk about everything women's health related, so kindly click on the subscribe button so you don't miss a video, and also like this video so that YouTube can show it to other people. Thank you. So the first color of discharge we're going to talk about is clear or white. Normal vaginal discharge is usually clear or white, and it varies in consistency throughout your menstrual cycle. For example, while you're ovulating, your discharge is going to be slippery and stretchy, and that's because of an increase in estrogen levels. This kind of discharge, they help the sperm swim towards the cervix, and that's going to help with fertilization. Now, other times, like after your ovulation or just before your period, your discharge is going to be thick and creamier, and that's also normal. Your discharge is your body's way of keeping the vagina clean and healthy by removing old dead cells, preventing bacteria, preventing infections, and just maintaining its pH. As long as your discharge is clear and white, as long as it does not cause any kind of vaginal discomfort, then your body is doing its job. That is why you don't need feminine wash, you don't need to insert anything to keep your vagina clean, because your vagina can clean itself. The next color of discharge we're going to talk about is yellow or green. If you notice a yellow or green discharge, especially if it has an unpleasant odor or is just more than usual, then this could be a sign of a sexually transmitted infection, an STI. Now, when we hear STIs, we think gonorrhea, herpes, chlamydia, but the one that is most commonly associated with a frothy yellow-green discharge is trichomoniasis. So, along with the change in color and the unpleasant odor, you'd experience itching, burning sensation while urinating, pain during sex. This infection is actually more common than gonorrhea, but it's always missed because the symptoms are mild or it's just absent. That's why if you've had unprotected sex, it's best that you go to the hospital to get tested. Trichomoniasis can be treated with antibiotics. So once you just notice a yellow-green discharge, don't wait for other symptoms. One symptom is enough. The thing with STIs is that the longer you leave it, it now turns into a complication, and then you were supposed to just take antibiotics. Now you have to take a couple of other drugs. So one symptom is enough. Gonorrhea too also causes yellow-green discharge, so go to the hospital. Of course, STIs, what is the thing that causes is sex? So how can you prevent that? One, abstinence. See, trust me, by the time you're about to get married, you guys are going to do different kinds of tests and you know what you're signing up for. Number two, if you must have sex, then make sure you use a condom. Number three, multiple sexual partners is not good for your spirit, it's not good for your soul, it's not good for your body. Number four, if you notice a yellow-green discharge, then make sure you inform your partner. Because if you go to the hospital and get treated alone, then you come back and have sex with him, you are going to get reinfected. The next color of discharge I want to talk about is gray. If you notice a gray discharge, then this is a sign that you have a condition called bacterial vaginosis or BV, and it's usually because there's an imbalance in the normal bacteria in the vagina. So your discharge is going to be gray, it's going to be watery, and it's going to have this fishy odor. So if you have ever wondered why you have a fishy odor down there, it's because you have bacterial vaginosis. Now, some women say this odor is stronger after sex and just right after taking their shower. Now, of course, having a fishy odor down there can be very embarrassing, and because of that, most women now go all in with the feminine hygiene products and vaginal deodorants. But the thing is, the reason you have a BV is because of an imbalance in the normal bacteria. Feminine hygiene products and feminine wash and all of that, they disrupt the pH of the vagina. They cause it to be more imbalanced. So now what you're doing is not keeping it clean. I understand with you and I sympathize with you, but what you're doing is not keeping the vagina clean. It's not helping with the BV, it's just making it worse. So go to the hospital. BV can be treated with antibiotics. Again, the thing with leaving STIs untreated for long, it turns into a complication. I now have to treat it either for so long or you have to take a lot of drugs, and you don't want that. Itching, burning sensation, pain during sex should not happen with BV, but then some women, they experience it. So the next color of discharge I want to talk about is pink or red. If you notice a pink or red discharge, it can be normal or bad depending on your circumstance. For example, if you're expecting your period, a pink or red discharge just means that your period is about to come. and that's okay. Towards the end of your period too, you can notice like a brown discharge, and that is okay. It's just old blood leaving your vagina. So the blood has been in your uterus for so long, it got exposed to oxygen, it got oxidized, and now it is brown. It's just your body's way of wrapping up your period, and that is okay. The next time is like 30 minutes or 24 hours after sex, and that's because of irritation to the cervix, or during penetration, you know, there will be vaginal cut, and that can cause your vaginal to bleed. So that's okay. So when is it not okay? If you're not expecting your period and you notice a red discharge or a spotting rather, it could be a sign of hormonal imbalance or pelvic inflammatory disease. 2, if you are expecting your period but then a week or 2 weeks prior you've had unprotected sex, that red spotting that you see and you're thinking, oh, your period is coming, it's not your period, it's implantation bleeding. That means you're pregnant, and that can be good or bad depending on what you've been asking God for. Next, if you are pregnant and you see a red spotting, it could be a sign of miscarriage, and then you should go to the hospital. Next, it could also be a sign of cervical polyps or infections, or in very rare cases, cervical cancers. So if you notice red spotting that is just out of the ordinary, for example, earlier I said red spotting just before your period means your period is about to start, but if this is not something that is normal with you and suddenly it just started and it's been constant for a while, then you should go to the hospital. If you notice red spotting that comes with pain or cramps or any vaginal discomfort, you should go to the hospital. The next color of discharge I want to talk about is white, thick, and clumpy. If you notice this kind of discharge, and this is a sign that you have a yeast infection. Yeast infection happens when there's an overgrowth of yeast in the vagina and is accompanied with itching, burning sensation during and after urination, pain during sex. If you think you have a yeast infection, I made a whole video talking about why it happens, what causes it, how you should treat it, and when you should see a doctor. I'm going to link it in the description, so you should watch it immediately after watching this video. How can you prevent abnormal vaginal discharge? Number 1, good hygiene. Now, because we say you shouldn't wash your vagina, you should just wash your vulva, I think people confuse the both and then they just don't wash at all. But you should clean your vagina. The parts that you shave, you should wash it. Number 2, yes, I say you should wash it, but washing with water is enough. If you must use soap, then make sure that the soap is unscented. So scented soap, scented wipes, scented tampons, scented pads, douching, you don't need that. It's not going to help with your vagina. It's not going to help to keep it clean or healthy. You don't need that. Number 3, cleaning from front to back. I know you've heard this several times, but let me just explain it again. From your anus to your vagina is very short, and it's very easy for bacteria to move from your anus to your vagina. That's why you should clean this way, so that the bacteria stays where it is. It doesn't move to your vagina. So clean from front to back. Next, cotton pants, cotton underwear. So you've heard this several times and you think it might be a joke, but then your vagina does not like the extra moisture, so you need to wear something that will allow you to breathe. Next, from time to time, don't wear anything to sleep. Don't wear pants to sleep. Just wear a loose fitting shirt. Next, try to shave. Yeah, try to shave. Again, your vagina does not like additional moisture, so make sure you shave just to prevent any kind of bacteria build-up, bacteria overgrowth. Try to shave. Next, abstinence. The more I think about sexually transmitted infections, the more I understand why God said we should just wait till when we are married to actually have sex. Because you will just see, let me tell you, God's will and plan for you is not so that you be taking drugs every 2 weeks. It's not so that you be treating infection. That is not his will and plan for you. So abstinence, yes, it's very good. If you must have sex, then make sure you practice safe sex. And when I say safe sex, I'm not talking about contraceptives. And let me just say this here, I like it when young girls, emphasis on young girls, they know the kind of contraceptives they should use to just prevent stories that touch their heart. I like that. But on the other side, I'm like, why are you so knowledgeable on this thing? Like, you're not a pharmacist, you're not a doctor. Why do you know so much? Again, I promise you that if you're not married, having sex before marriage is not God's will and plan for you. Like, just, okay, let me just put it this way. Don't forget about God. How will you forget about God? But in case you want to forget about God, there's really no benefit to having sex before marriage. Honestly. So yeah, abstinence, but if you must, then make sure you use a condom. Next, drinking enough water. You might think that water does nothing, but it does a lot. You urinate frequently when you drink enough water, and that urination, while you're urinating, yes, you're washing out bacteria. So yes, drink enough water, take a lot of fruits too. With that being said, my name is Emedion Francis, and I'll see you in my next video.